Welcome to another episode of the Life in Motion podcast.
I'm your host, Ben Aguila, a doctor of physical therapy, and our topic for this episode is THC, CBD, and marijuana, an intro for PTs regarding cannabis sativa. Today, our guest in this episode is Lori Zucker, PT, DPT, MA, and CYT. Been a PT for over 30 years, primarily as a clinician who has been integrating complementary therapies into her practice. Lori also has presented at state and national PT conferences, as well as being an international speaker on a variety of subjects. She is also the adjunct professor at Rutgers University's physical therapy program for over 20 years. She was recognized by the APTA New Jersey State Chapter with an Excellence in Clinical Teaching Award. She is a certified cannabis educator, helping to advise patients and healthcare professionals on the use of medical marijuana. Dr. Lori Zucker, welcome to the podcast.
Thank you so much, Ben. Thank you for inviting me to speak. I'm really excited about this topic. I think hopefully your viewers will find me interesting and excited about this.
Thank you so much. I have to be very honest here. I think right off the bat, a definition of terms is very important for lay people. And frankly, even for myself, because I can mistakenly interchange the terms that are being used. Can you please help educate us and differentiate the terms, marijuana, hemp, cannabis sativa, THC, and CBD?
Yeah, this is a perfect place to start. When I first started learning about this, I also didn't understand it, and I don't even think the kids on the streets who are interested understand it. But here's how it goes. The genus, the family of plants is called Cannabis sativa, L. Underneath that, we call things hemp and marijuana. But understanding that marijuana is a name that only came into being, I'm going to say not even 50 years ago, in the 1930s, let's say. So, my math is not good. Quite a bit more than 50 years ago, but in the 1930s. And it really was a little bit of a racist term because marijuana is the name of this plant out of Mexico. Here in the United States, it was always called cannabis, all the way through from literally from the 1600s, all the way through till the 1930s or so, when there was some political underpinnings that wanted to pin cannabis and the immigrants coming across the border from Mexico during the war, the Mexican War. And so they started advertising marijuana as being an immigrant issue. And so we adopted it here in the United States as marijuana. But we as healthcare professionals, as interested parties, need to understand that hemp and what we call marijuana are all cannabis. So the term cannabis could be used for both, but to understand it more easily, it makes sense to separate it out into two different things, because here in the United States, hemp has been used from colonial days for industrial purposes, to make sails, to make clothing, to make baskets. It was actually all of the farming that was here in the early days. The farmers were required to, I would say about 20% of their crops had to be hemp, because it was so valuable and it was so needed here in the colonies and of course in England. So it was a requirement to grow cannabis in the form of industrial hemp. In our world today, and literally I'm talking about in the last 5 years or so, we now think about hemp as the industrial side, but also the more medicinal side, where people are seeing hemp or cannabis in the form of CBD, which is much more coming out of hemp plants than, let's say, marijuana plants. And the difference between the two is that marijuana is psychoactive. It's intoxicating, as many people know about pot, weed, whatever you want to call it. Whereas CBD, which could come from a plant whose intent is to get you high or stoned, primarily in our world, it comes from hemp plants that are grown a little bit differently, that are a little bit easier to grow than, let's say, pot plants.
Right.
And we use hemp now industrially, but also to produce some CBD and some other cannabinoids. The cannabinoids are the chemicals in a plant that are joined together. Sometimes a plant might have lavender, or it might have vanilla, or it might have some other chemical factors that are involved in the CBD tinctures. I just want to make a distinction, for all of us and for the audience. Hemp is now defined by us as of 2018, December 2018, as cannabis plant that has less than 0.03% THC. And THC is the intoxicating part of a marijuana plant. Oh, actually, I've said that wrong. I apologize. It's 0.3. So it is less than 0.3% of THC. If a plant is found to have more than that, it is no longer, it is considered actually federally illegal. And so we could talk a little bit about that. But a marijuana plant has greater amounts of THC, and a hemp plant has the least amount of THC possible.
Right from the get-go, Lori. And I was hoping to learn, but it's amazing how you pulled from biology, you pulled from sociology, you pulled from history, right? It's very closely intertwined. I love that idea now. So hemp was industrial and maybe a little bit of medicinal. Marijuana, more or less, you're growing that for the purpose of getting the psychogenic, the THC, the one that gives you that buzz, that high, which has launched stoner movies everywhere, right? Yeah. So we're separating those two, and you've helped us understand that you can get CBD oil from both.
Correct.
But CBD oil tends to be easier to extract from hemp, not the marijuana variety.
Right. Well, yes. So, okay. So I don't want to confuse the issue, but I want to say just two things. You are totally correct. Financially, if you are a grower and you want to make THC plants that are high in THC or pure or a certain variety of THC, you probably aren't going to spend your money trying to also boost the amount of CBD in that plant. It's a little bit of a different growing process. Right. Whereas in hemp, since you really have to keep the amount of THC down, you can let the CBD and some of the other cannabinoids flourish. And so it's a little bit of a different growing process. And I think financially it makes more sense. Then, of course, there's the whole political, legal circumstance where a grower of hemp can actually be in any one of the states in the United States. Every one of our 50 states, it's allowed, whereas that is not true of, let's say, what we would call a cannabis marijuana plant. So that's it. But I do want to just step back for just a moment. The way that I grew up, in the 70s and 80s, thinking about weed, which was essentially say no to drugs and that it's all bad. In my learning over these last several years, cannabis was always a medicinal plant. And when you look far back in history, all the way to the Greeks, Herodotus and things like that, we see real evidence, not just historically written evidence, but chemical evidence that they're able to, through anthropology, find out that cannabis was used for pain control and other things. So THC, which I am calling intoxicating or psychoactive, is also used medicinally, as it had been up until we here in the United States decided to, take out a vendetta against it. And of course, you're hearing my bias, but as prohibition went away and the alcohol came back onto the scene, the people who were interested in a prohibition situation latched on to cannabis. And prior to that, in 1920s, cannabis was used for many, many different medicinal purposes, and there's quite a lot of medical writings about it.
Okay. So I think it's a good segue to the next segment that, we believe it's very important to disclose. For the purposes of this podcast, we are discussing primarily the medical use of marijuana in the United States, and specifically New Jersey. Both Dr. Zucker and I reside and practice in New Jersey, which passed in 2010 the New Jersey Compassionate Use Medical Marijuana Act. And then released to law enforcement the Attorney General Guidelines for Police, where the use of medical marijuana under a physician's prescription is allowed. So we strongly recommend that our listeners, please consult your local, your state, and your national laws about the legal status of medical marijuana as you delve to understand this relationship more with your practice and your location. Having said that, Lori, can you give us a brief overview of the current legal status of marijuana in the United States at the national or state level, both for medical or recreational, if possible?
Okay, so you're asking a great question, and of course it's very complicated, and I can give a general overview of where we are today. Happily, New Jersey will be voting on this as a popular referendum on Election Day, and so we'll find out if New Jersey will join the ranks of adult use marijuana. So before I answer your question, Ben, I just want to differentiate between recreational use, medicinal use, and adult use. And so we're moving towards or away from the term recreational, because somebody who doesn't have a certification or a license or a card to get medicinal marijuana may still benefit from some pain control or some muscle relaxation or something like that using some cannabis. And so the difference that I'd like to point out is that there's medicinal, you have a medical marijuana card, and I'll get to that in just a moment. Recreational, that might be more like, hey, I'd like to use some cannabis instead of a glass of wine. Alcohol doesn't work well for me or something like that. I'm in a place where it's inappropriate, but I can use some cannabis in the form of an edible or something that is not quite so obvious. And then there's adult use. And the difference here is that somebody who is trying to help themselves feel better, but doesn't want to use Advil or doesn't want to go and buy an over-the-counter medication could use cannabis in states where recreational marijuana is legalized. Right now here in the United States, we have 11 states that have ratified both medicinal marijuana and recreational or adult use. Here in New Jersey, we have medical marijuana for, as you mentioned, many years, but we have not ratified as a state, either through a popular vote or through a legislative initiative vote, the use of adult use marijuana. So the circumstances are like this. In the United States, there are 33 states that have allowed the medicinal use of marijuana. Each one of those states has jurisdiction over which medical diagnoses fall into the category that allow you to have a medical marijuana card. In New Jersey, and I believe in most of the states, except for maybe Colorado and maybe California, you get a card. You go to a medical doctor. You, of course, have a doctor's visit. You have a complete evaluation. You submit some paperwork, and if you fit into one of the categories, and New Jersey is pretty liberal on what fits into a category: chronic pain, glaucoma, PTSD, things like that, obviously, some anxiety, other medical diagnoses, you would be issued a card. That card allows you to go to a dispensary and purchase cannabis in any one of many forms. It does not tell you how much. It does not tell you when to use it, how to dose it, what's the best way to ingest the cannabis. It simply certifies that you have a diagnostic condition that New Jersey and many other states agree is worthy of you using some cannabis. So interestingly, New York and New Jersey, which border each other and people go back and forth all the time, have different things on their list. So if you happen to live in New Jersey, you may be able to get a medical marijuana card for something like chronic pain, whereas if you're in New York, perhaps not. And then every other state has their own list of what's acceptable. So that's a little bit challenging to totally understand how this works. But here in the United States, each state is allowed to make their own decision. And then we have the overarching federal government. And as to the federal government, all cannabis is illegal. And so it's quite a challenge. In 2018, December of 2018, there was the 2018 Farming Bill. What that did, it's a federal bill, and what that did was restore the legality of people growing hemp. And so now, as of 2018, and maybe people even recognize this huge explosion of hemp products, CBD products, because it's only about 2 years since they allowed the growers, the farmers, to legally plant cannabis plants that are the form of hemp. Very, very low, almost negligible THC, higher other cannabinoids. So I'm not sure if I answered your whole question.
Oh yes, that totally gets it. You know, there's the musical Hamilton, and one of their funniest jokes was they say everything is legal in New Jersey. Well, no, not especially for medical marijuana use. There's like listed conditions, and I love your advice where basically, even if it's okay in one state, it may not be okay in the next state over. So that gives your precaution that people should be aware. If they are in possession or use of marijuana, they have to be very mindful of state lines, just because the jurisdictional laws might change.
Right. So as soon as you cross state lines, that is federal. And that's just the way we work. And so somebody with a medicinal marijuana card in New Jersey who wants to get on an airplane when it's not COVID-19, get on an airplane and go someplace else, they are running afoul of
we think about it very well.
Federal law, and it's really very, very confusing. And my suggestion is many states will allow reciprocity. Many states will begin to say that if you're certified here, we will understand and accept that. But as of right now, I could not take a medical marijuana card that was issued to me or my patient or something, and let's say go to Massachusetts and have them honor it. That would not work. Now, here's an interesting difference. And New Jersey is moving in that direction. In most states, let's just pick a state, let's say California or Colorado, which has both medicinal marijuana and adult use marijuana. You can buy almost exactly the same products. So why do you need to have both? Because if I were a person post-car accident, God forbid, with multiple sclerosis or some other problem, and I was certified to obtain cannabis as a medicine, not just adult use, then the taxes are different. Then it cost me less. And so none of us, we all, God willing, most of us have some form of plan that gets us medication at reduced prices or free if you can't afford it, or through your insurance company. But that is not true of cannabis. So how come if my state has said this is medicinal, why, when I go, do I have to pay cash because none of them can accept my credit card, and why do I have to pay taxes on that? Because we don't pay taxes on our medicines. And so this is a very developing area. And in the next 5 years, I honestly believe we'll have much, much more clarity on all of these confusions between state and federal, financial taxes, things like that.
Wow. So that's really something to think about, especially with the medicinal values that are not being seen with CBD and how that can be, how can be applied. Now, I guess that's a good way for us to move on to the next question. But what will be the methods that people may intake these plant derivatives? What are the various modes of transmission that we can expect?
Okay, so I think probably any listeners who are familiar with weed, with cannabis, will know that there are some very, very familiar. You could smoke it, you could vape it, even if it's not the best idea. There's bongs and many other inhalation techniques. So inhalation is one way. And there are real differences between inhaling a vapor, let's say in the form of a vape pen, or heating it up and inhaling just some vapor, as versus smoking, where the, some of the joint or the blunt or whatever it is that you're smoking just goes up in smoke. Some of the weed just goes up in smoke. The cannabis goes away. So there's that. There's edibles, and edibles come in all manner of things: chocolates and cookies and caramels and sodas and mints and all kind, almost anything you can think of. Popcorn. I was in December, so a year ago, December, I was in Las Vegas at a cannabis conference. 75,000 people were there, and I think it was like 1,100 vendors. And I can promise you that anything you could think of that's an edible, they make it in in some form of cannabis. So that is something that would go through your digestive system. So one is going through your lungs, another is going through your digestive system. Then, of course, there are tinctures, which you would put, let's say, under your tongue and let that absorb through the through your the capillaries,
like
really.
A dropper underneath your tongue?
A dropper, yes, a drop. 1 drop, 2 drops, 3 drops, definitely. And that's actually very easy to titrate. So it's a favorite among medicinals because it's 1 drop, 2 drops, 3 drops, or the pipette, tells you it's 1/4 milligram or something like that. But then you also want to know there are topicals, there's suppositories.
Oh, okay.
There are things, for all manner of people. God forbid, a person has, cancer of some sort, and cannabis would be an appropriate medicine, but simply a person cannot digest or swallow. We have a suppository. And this is one way where you can differentiate between medicinal use or, let's say, adult use for the purposes of medicine as versus recreational, because nobody who's interested in recreational is using suppositories. Yes. That's just not happening. Right. So there are many ways, and we don't have time here to talk about the benefits of, let's say, inhaling and how quickly that comes on versus going through your digestive system, which would be a much slower onset but last for a very long time. Let's say time released as versus immediate. Right. So there's a lot.
There's a lot to figure out about that, about the how you take it, because when you're smoking something, so you're now concerned about inhalation, right? So that's a legitimate concern. You want to make sure the lung tissue is healthy. You're ingesting something, and we want to know how is the GI system dealing with that substance. And that's what's interesting when I was reading the research. We have trouble dosing. We have trouble figuring out side effects because we're not allowed to do research.
Correct. There is a lot. This is a huge topic. Again, it could be a separate podcast altogether, but there is research allowed. Interestingly, on the federal level, all the research is categorized as for a Schedule 1 drug. So there are 5 categories of medications. The federal government has a categorization, Schedule 1 to Schedule 5. Schedule 1 means that it's a highly addictive medication. There's no medicinal use, and it is very, very dangerous. And what our government really since the 1970s has done is put cannabis in that category as a Schedule 1 drug along with heroin, LSD, things like that. Whereas morphine and codeine are down the list. You know, morphine and codeine is Schedule 3. It's it effectively, they say it's less dangerous than cannabis. However, I mean, that's a whole other discussion. But in order to do research, how do you go and get an IRB or get a grant or anything like that when you say to them, look, I'd like to do some research. It happens to be a Schedule 1 drug, which the government says there's no medicinal use for, but we want to look for medicinal use.
IRB is going to run the other way and say, no, we're not having this conversation.
So there actually is research being done here in the United States, but the majority of it comes from Canada and from Europe and from other countries. And so we're learning much more. And here in the United States, to do that research, there is one crop in Mississippi that has been allowed to be grown, and that is federally legal. And so if you have a Schedule 1 research license, which many people do, Columbia, many other schools, you have to petition to get cannabis from Mississippi and do your research. I happened to be at a conference listening to Margaret Haney out of Columbia. She has a Schedule 1 license, and she has a lab to do cannabis research where people live in her lab, because you can't give this medication to somebody to take it home when they're taking a Schedule 1 drug back to their house. So they have to come in, ingest, however it is, inhale, whatever it is you're doing, and then they do their research 8 days, 14 days, 3 weeks, where they're asked to live on campus. It's very, very interesting. But I will just make a differentiation. In the last 6 months or so, 2 states have allowed research within the state, Connecticut, a state-grown crop in a state facility, and that research is being allowed. So this is only literally, it essentially end of 2019, early 2020, that the states and I'm going to say the government, the populace are taking over, saying enough is enough with our federal limitations. And so more research is coming. More research is coming.
Science is finally moving, and even though federal was maybe moving at a pace that the community was actually being hindered by, at least at the state level, stuff is being learned and discovered, and so we can really figure out the help versus harm ratio and see how can this be of help to people. Because I'm going to drop the word opioid. The opioid epidemic is a very big reason why I'm looking at CBD and marijuana. I'm thinking, what really is the risk versus reward ratio here, comparing the two?
Yeah, well, of course, you and everybody else are asking that very, very same question. And there is research that shows a decrease in pain using THC. There is some research with CBD as well, with CBD with no real THC in it, with no real intoxicating chemicals. But we're still looking, and there's a huge amount of science. When you mentioned that we were teaching at CSM at Combined Sections meeting in 2020 in February. Ellen Anderson,
Denver, Colorado.
In Denver, Colorado. Ellen Anderson and I, our partners, we spoke, and we went through some of the research and some of the mechanism of why CBD is looked upon as a possible painkiller, and certainly THC. And that has all to do with the endocannabinoid system, the system that we have inside our bodies, just like your immune system, just like your cardiovascular system. It was only discovered in 1992. And so we are very much learning about it, but it is beyond fascinating, and it behooves all of the physical therapy programs, rehab programs, OT programs, any of our medical programs to include the endocannabinoid system when we are learning about other systems, because a systems approach, as you mentioned, what medications interact, what happens when you digest, what's going on, is very, very important. And I'll mention that smoking marijuana, although it's something that I have not done in probably 40 something years, and I've never vaped, smoking has not been shown to irritate the lungs. And because of that, even though people choke and stuff, because of that, they're looking at, is there a protective piece of cannabis to lung tissue? And digestive wise, depending on how you ingest cannabis, can it be protective of the lining of the digestive system? And that's because of the cells that they're finding and the receptor sites for cannabis all throughout our body, in almost every organ, almost every system has receptors for the components of cannabis. Quite interesting.
So we're going to shift gears here, talking now about more the practical aspects of how a PT may interact with a patient using medical marijuana. Can you help us figure out certain disease conditions or scenarios where a PT, in whatever setting, might stumble on a patient who's saying, well, I'm using medical marijuana, and what those usual diagnoses or clusters are vis-a-vis concerns you might have as a physical therapist with our intervention that we need to keep an eye out for, so what conditions and what interventions?
Okay, so again, a really important question for all of us. I want to point out, before I get a little more deeply into this, that here in the US, there are a couple of products that have gone through FDA approval and are approved, and they have been. A drug called dronabinol or Marinol it's been around for a minimum, 15 years or something like that, used for nausea. When taking chemotherapy. Wow. So what happened with what they did when they did the research and found out that cannabis was very helpful for that, they went ahead and made a pill, did a lot of research, took out all of the other ingredients and isolated THC and provided it as a pill that you swallow. There is also a dropper that's available called Sesamet, and that has been available, FDA approved. An MD can write a script for it, and you can get it from your pharmacy, and it goes through your regular insurance. But there are still the side effects, and what some of those side effects are the same side effects that you might get with THC, which would be, a little bit lightheaded. Maybe your gait would be a little off if you took too much. You might feel a little nauseous if you took too much, even though it was meant to help you with your nausea. So there are some side effects to even the FDA approved medications. Now, in 2018, the FDA approved a medication called Epidiolex. That is a CBD preparation used for seizures. It's almost exclusively CBD. It's produced by GW Pharma. It was a very big splash, really interesting story, but not for right now, time-wise. Charlotte, Fiji, if anybody's interested in looking it up, it's very, very interesting. That does also have side effects, and like every other medication available on the market, it lists, if you were to look up Epidiolex, it's used for seizures, Dravet syndrome, some serious seizures in children and then also in adults. But it can have some toxicity to the liver when it's taken in the amount needed to help control the seizures.
Mm.
So if we as individuals go out and buy CBD and decide, hey, listen, I know this is supposed to be good for me, I'm just going to take a ton of it.
You just can't
You know,
discount it.
right. I'm not sure that we would get to a level. I'm not sure we would get to a level that would create toxicity in the liver. However, if you're taking other medications, let's say Tylenol, or other medications that are a hit to your liver, or you have any liver disease, and you're adding high amounts of CBD without any medical professional knowing, we have trouble. And that's an over-the-counter. You can buy CBD today in CVS, in the drugstore, in the hairdresser, practically any place you go.
I saw that. I was walking through the mall and I saw a CBD kiosk. I'm going through my Men's Health magazine. I see an ad. I'm going, wow, this is such a timely topic to talk with Dr. Zucker because
Yeah.
it's in the zeitgeist of the population, whether or not you're for or against. So it's better to learn more about it so you can advise people.
It's quite a subject. Let me just mention that the CBD that you're likely buying, at your hairdresser or at the massage person or through through some other pyramid, commercial vehicle, I can't promise you that it's good. I can't promise you that it's legitimate. Let me take 1 second. THC, CBD, under the umbrella of cannabis.
Mm-hmm.
One of the things we know about cannabis is as soon as it's exposed to the air and the light, it begins to break down.
That'd be great.
That's true of this botanical, this plant-based product. Okay, so when somebody is selling you CBD, or if it's if you're in an adult use state, THC in a clear bottle, in something that's not so stable. I've got questions. And if you speak to the GW Pharma people about their products for childhood seizures, the Epidiolex, the CBD, they'll tell you its shelf life is 12 weeks.
Wow.
Once it's opened, it's 12 weeks. And that is a CBD tincture. So when you buy your own personal CBD tincture from someplace and you leave it sitting around for 6 months in the light, I don't know. Every medication, every pharmaceutical has an expiration date. And what we know is it becomes less potent. It's not going to hurt you terribly, but it's going to become less potent. And
potency is like gone.
We don't know. We don't know yet. We're still in that process. We're still in the process.
This sounds such a complex topic, and obviously we've already recognized it's beyond the scope of a short podcast like this to completely unpack. Where can our viewers learn more in depth about medical marijuana? Would they be able to reach you? Are there any online resources you would recommend?
Well, thank you for asking. Actually, Ellen Anderson and I have a website, PT Cannabis Info, my shirt.
I'm flashing it right now.
You could Google Lori Zucker, you could Google Ellen Anderson, and find us. But the truth is, if anybody has information, we have some informative webinars that will be on our website. There's a full glossary of terms. There's some really interesting essays about, let's say, Tylenol and painkillers and the endocannabinoid system. But just shoot us an email. Just get in touch. We will be happy to speak to you. We'll be happy to email with you. Our great interest is to get this information out to the general public. And so, happy to help in any way we can.
We are flashing your information right here on top of the screen. And at this point, we would like to really thank you, Dr. Zucker.
Thank you.
We hope our audience is now a bit more informed about medical marijuana and will be able to benefit from the shared knowledge and resources you graciously gave us today.
Ben, anytime. Thank you so much.
Time and for being a cannabis educator for the whole PT profession, really. And again, on that note, thank you for joining us in the Life in Motion podcast, and we hope to catch you next time.
Take care. Thanks so much.
Bye-bye.
Thank you for listening today to the Life in Motion podcast. Striving for excellence doesn't demand perfection, just be a little better in all that we do than yesterday. This is Ben Aguila. Till our next episode. God bless.